Hello, today we're talking about lumbago. I'm talking to Elizabeth Robinson, who is head physio at the Warr Physiotherapy Clinic, and just to get a little bit more information about exactly what it is and how best you can prevent it. So tell me, what is lumbago, Elizabeth?
Lumbago is basically the Latin name for low back pain.
Oh, okay.
So it was used a lot, and it sounds more medical.
Right.
Than low back pain, but it's the same thing.
It's the same thing.
It's the same thing.
So tell me, when you have got lumbago or low back pain, what are the main symptoms you experience?
Pain in the lower back. Very often you feel stiff, you feel you can't move freely, and a constant pain.
Okay, and can you feel that anywhere else, like legs or?
Occasionally it goes down your legs, front or back. And it can spread upwards too, because the muscles around your chest wall also get tight to protect you.
Okay. So when you've got lumbago, what causes you to get lumbago?
It can be either muscular, that you've lifted something too heavy or had a bad posture, or it could be that the bones are slightly out of true. Imagine you have got cogwheels fitting together, and if one of the cogs is fractionally out, it would then foul the system, and that's exactly what's happening in the back. So it's a matter of trying to realign that.
Because you were saying to me earlier about the fact that actually it's often caused when you're not lifting heavy things.
Yes, very, very often it's just bending down and picking something up. It could be a bit of soap in the shower or a bit of piece of paper on the floor. Most of the times it's the light weights that cause the pain. If it's heavy, you know it's heavy, you brace yourself and you don't put your back out so much. But if it's the light things, you just bend down and twist or reach up and twist, and the twisting does it.
So essentially we take more care when we know something's going to be difficult than...
Yeah. Instinctively we would do that.
Yeah.
But when it's something just lying there that's irritating you, we just reach and get it.
I know I've leant down to pick a book up out of the side of my bed and put my back out doing that.
But that fits the picture beautifully.
Yeah.
You're nicely relaxed, your muscles aren't working overtime and holding you in place, and you just reach for something that doesn't appear to be heavy, but it's just...
So you're not taking care. Yeah. So how do you as a physiotherapist treat somebody with low back pain or lumbago?
Analyze whether it is the bone structure or whether it's muscular, and then try to relax the muscles to give them a chance to let go and treat the underlying joint, which may be fractionally out of true, with either mobilizing or even manipulations if necessary.
Okay. And how soon should you come to see a physiotherapist with low back pain?
In general, I would say sooner rather than later, unless you have got a huge amount of muscle spasm. And then you're better off getting some painkillers and perhaps muscle relaxants from the GP, and then come when they've started to work a bit, because it's difficult sometimes to relieve the pain when you have got a lot of muscle spasm, right, which is your own defense mechanism working all the time.
Yeah.
A hot bath helps, hot water bottle, don't burn yourself. Wrap it in something, I've seen a few burns.
Right.
So that'll help, and then gentle exercises.
And how best can we prevent getting low back pain?
Building your back muscles up helps a lot, particularly the small ones which go from one spinal body to the next. And that is Pilates, core stability exercises. Being aware of posture is important, that you have a good posture, and avoid twisting.
We'll stand up, sit up straight.
Absolutely.
Lovely. Well, thank you very much for your time today.
It's a pleasure.
Thank you. Yeah, I hope that gives you a little bit more information, and of course if you do need any more, please give us a call at the clinic. We'll be delighted to help you.